Hello and welcome to the health program on Trust Television. I am Aisha Salihu, your source for health information. On today's episode of the program, we'll be delving into a critical health issue that has recently affected the community in Maiduguri, Borno State, a viral infection, measles. You may want to know how a viral infection works. It can lead to a spectrum of symptoms from asymptomatic, that is, no overt symptoms, to severe disease. People may get viruses by swallowing or inhaling them, by being bitten by insects through sexual contact, or congenitally, that is, passed by a pregnant person to the fetus. But our focus on the program today is on measles, a childhood infection caused by a virus. Once quite common, measles can now almost always be prevented with a vaccine, also called rubeola. Measles spread easily and can be serious and even fatal for small children, while death rates have been falling worldwide as more children receive the measles vaccine. We're joined by Dr. Koli Jumbo, a medical activity manager and a representative from Medicines Sans Frontiers, who will shed light on the current measles outbreak in Maiduguri. Welcome to the program, Doctor.
Yes, good afternoon and thank you for having me.
You're welcome. Now let's start by discussing, say, the causes of the measles outbreak in Maiduguri. I mean, what factors have contributed to this situation?
Well, the factors are multiple, but given the fact that we know that measles can be prevented by vaccination, in simple terms, what we can say is that the population has not been fully covered with the vaccination. However, efforts are in place and for more of the population to be covered, especially those people who are moving. So what we find is a bit of a complex environment where people are displaced. So it's difficult to keep track of the movement of people, but the actors who are responsible for these things are not sleeping. There has been some reactive vaccination campaign recently, and more are planned in future, apart from the routine vaccination campaign. So hopefully we'll be able to, in no distant time, cover all the gaps among the population that are vulnerable.
Thank you so much for that response, but I'll come back to the vaccination issue, which is the major cause of the outbreak at the moment. But in order to understand the context of our discussion, let's take a look at a report from Maiduguri where health experts have also called for a swift response from relevant agencies of government to halt a further spread of measles in Borno State, and also reacting to the recent rise in the number of measles cases recorded in the state capital, the warned that any further delay could endanger the lives of children. Trust TV's Beatrice Kurisi has more.
The Gwange Clinic is one of the health centers where isolated cases are treated. The facility is struggling to contain the outbreak of measles with a record of more than 7,000 cases, despite treating 9,618 patients, mostly children. The facility admits more than 30 patients daily. The medical activity manager, Okoli Jumbo, said mortality rate stood at 1%, which indicates that there is need for urgent intervention, adding that patients, mostly children, experience difficulty in breathing and malnutrition, which is slowing response to treatment.
The case fatality from last year is less than 1%, but it's important to really suppress this transmission, because even though it is the case fatality, if you look at absolute numbers, it's actually very significant, and we don't want to lose our children that way. At some point, we still expect the numbers based on the trend and the pattern over the years. We still expect the numbers to go up. So at one point, we might become overwhelmed. So based on our speculations, things are still going gradually upward, in upward trend. Now, They have taken up the whole ward. The whole unit in the hospital is filled by cases.
Measles is a childhood infection caused by a virus which can be prevented with a vaccine. The disease globally claims over 200,000 lives annually. Some of the patients' parents share their experiences. She started experiencing discomfort around her neck and chest before I took her to the hospital. The mom was not at home because she had gone to Gamboru, although she was not running a temperature. She, however, couldn't lay on the bed. I was very worried for her and could barely wait for a daybreak to take her to the hospital. Yesterday, we were taken to another section of the hospital where she started receiving treatment.
He wasn't feeling too comfortable, so they inserted a tube in his nostrils. After that, he was relieved, but when they removed it, breathing became difficult. Right now, we have spent 3 days in the hospital. Before we came to the hospital, he couldn't breathe normally and he wasn't eating. But now, he eats and breathes well.
Health experts are calling for effective sensitization of the public to curtail the outbreak in vulnerable communities. Bitrus Kuruti, Trust TV News, Maiduguri.
Thank you so much, Bitrus Kuruti, and we still have Dr. Jumbo Okoli on standby to address that particular report. Doctor, those are quite a lot of figures you have stated in your interface with Bitrus. I mean, how did we get here?
Yes, so if you look at the background over the years, as I said, there's been a problem with insecurity and IDPs. So this means that there's a lot of population moving around, and it's very difficult to keep track for children who are vaccinated. Also, the insecurity means that there are places that are hard to reach for the health actors. So these inaccessible areas, probably due to insecurity, means that sometimes coverage might not be optimal, bearing in mind that you need at least over 95% coverage for vaccination to suppress a measles outbreak. So that is very high when it comes to coverage and the standard required. So it is something that is not easy, but the efforts are already in place by all the actors, government agencies, WHOs, and all the health actors are all working in synergy to ensure that every child is reached in this community.
Before we address the role that all of the actors are playing just to ensure that every child is reached to cover vaccination, I'd like for you to put us in the right direction. I mean, what signs and symptoms should parents be aware of, I mean, to identify measles in their children? In that particular report, we saw parents who were kind of distraught, but, you know, it would be better if we get a sense of the signs and symptoms and also, say, the stages of infection of measles.
Okay, for the parents, the signs and symptoms are very classical, especially at the second phase. The initial phase, the prodromes phase, the child would have a fever.
The clinic is one of the health centers where isolated cases are treated.
Subsequently, the child will develop a rash after about 4 days of this initial stage. So at this stage, the parents really recognize this illness as measles, and they usually will present to the hospital, especially if they come down with other complications such as diarrheal diseases and pneumonia. So these are the common symptoms that they will see. Child will have red eyes, a runny nose, cough, catarrh, have a fever before the rash. Normally the rash starts from the face and then spreads the rest of the body.
Still in line with the symptoms that you have stated clearly, this now brings me to the point where we have to address the myth surrounding diseases like measles. A lot of people mistake chickenpox for measles, perhaps because they share somewhat same symptoms. How do you differentiate between measles and chickenpox?
Okay, both have these rashes, but measles normally is more involved with other symptoms like conjunctivitis, that's redness of the eyes, runny nose, diarrhea disease. So while chickenpox usually presents only on the skin, it can give you fever also, but measles would have more involvement of the eyes, for example, other mucosal membranes. So this is the how to differentiate both of them, especially for the parents. So this would be one distinguishing feature for both of them. And then also the way the rash spreads, usually the rash and the character of the rash. Usually the rash of measles is described as being maculopapular, so they kind of tiny, flat, and rashes, while that of chickenpox is a bit umbilicated, so meaning that it's raised a bit, and you see kind of a punctum in the middle of each of the umbilicated lesion. So when you see an umbilicated lesion with a punctum, it will be chickenpox, but for measles, it's more like flat macular lesions. So these are lesions that are flat. So that's a bit of difference in the type of rash that they present with.
Thank you so much for that clarification. Now, still in line with debunking myth, there is a misconception that being infected with measles is a way to build the body's immune system naturally, like chickenpox. However, measles can potentially be fatal. Around 5% of children with measles get pneumonia, the most common cause of death from measles in young children. What is your take on that?
Well, there's two sides to the coin. Yes, when you're infected with measles, it gives you immunity from future infection, but you don't have to be infected to get the immunity. We have vaccination. Vaccination immunizes the children and any population against the disease. So it is going to be very costly to say, let's get all the children infected with all the morbidity and mortality associated with the disease, even far removed from the acute illnesses. The child has a high risk of death from other things like malnutrition down the road, like other infections due to immunosuppression from measles, other form of encephalopathies down the road. So the cost of infection in the outbreak in the population is very high. So it is not a very viable route to have the population immunized. So the better option would be vaccination, prevention of all these complications and health burden.
Now, this now brings me to my next question. It's not enough that we're talking about measles without also addressing how it is diagnosed, because a lot of people may not even be aware of how to go about diagnosis before they can have a full confirmation that this particular case that they're dealing with is measles.
Yes, actually, the clinical diagnosis of measles is very accurate from the second stage when the child develops a rash. So at this stage, even the mother's diagnosis is pretty accurate, especially in our environment where it's almost endemic. So you see that the parents come with the conviction that their child has measles. So most times those symptoms that you have are the things we use to make a clinical diagnosis. If you want a laboratory or confirmatory diagnosis, especially to really make a declaration of an outbreak, you will need to go to the molecular lab and do a gene sequencing and PCR test. So this will give you a definitive diagnosis of measles and help in the declaration of an outbreak. So, but for all practical purposes, the diagnosis is clinical with those symptoms, signs and symptoms that I've earlier enlisted.
Oh, we'll come back to you, Dr. Okoli. Let us now go straight to check about some facts about measles that a lot of people may not be aware of. We'll be right back. Well, there you have it. If you didn't know those facts about measles, now you have it. Now you know it. Now we still have Dr. Okoli Jumbo still with us, and we're talking about measles outbreak in a community in Maiduguri. And now earlier he talked about vaccination, where lack of full coverage of vaccination is primarily the reason, the cause for this particular outbreak. Now, still in line with vaccination, Dr. Okoli, let's talk about, say, the role of vaccines and pharmaceuticals in preventing and treating measles. Yes, you have stated that earlier, but my point now is that a lot of people, you did talk about the hard-to-reach areas in Maiduguri, and also the fact that some of these health workers may be unable to reach those areas and catch these children. Now, I'd like for you to put us in the right direction, state it unequivocally how vaccines are relevant and necessary in curbing and preventing measles, and also say the roles of pharmaceuticals.
Please, can you recap your question because of the network is
Okay, all right. So I'm going to take that again. Earlier, you talked about vaccination and how the fact that there is no adequate coverage of vaccines for children in this area. I mean, we're talking about the northeast part of the country where we have had a lot of security issues. Now, my point now is we have to inform people in those areas because we still have issues of vaccine hesitancy. I'd like for you to put us in the right direction, how it is relevant and also necessary, stating it unequivocally how it is relevant for women or men, that's fathers, mothers, parents of children in this region, to ensure that their children are taken for vaccination at the primary healthcare centers.
Yes, so I think that it is very important that this message is passed across through all the media, both through the churches, the mosques, the religious leaders, traditional leaders, the government agencies, hospitals, and everybody should be echoing the same message to ensure that it gets to every nook and cranny of the population, that it's important and very safe to get your child vaccinated. the good thing with the vaccination is that if we're able to achieve over 95%, we're going to protect everybody, prevent an outbreak in any community. So there are some people might have some reservation with vaccination, but I can tell you there's no worries. It doesn't cause infertility. Vaccination doesn't cause infertility. It doesn't cause any developmental problem, as some people would have, as myths. But those things are unfounded. It's very safe, and it's good that every child is protected.
Speaking about reservation, we have heard that people in those areas say that when they get their children across to the centers for vaccines, their children may develop autism. What can you say about that?
I think there's no fact, there's no evidence that support that. It is a myth. Some of the problem we have in development is that sometimes it can coincide with the time whereby some diagnoses are made or some problem develop in a child and it is associated. But these things are mere confounding factors. That something happened at that particular time doesn't mean that that is the cause. So if, for example, a child has a problem totally unrelated around the time the child got a vaccination, people might tend to associate it with that, but it is not the case. Some of these things are isolated cases and they are just coincidence. There's no link to vaccination and autism or any other illness for that matter.
Okay. Now, just very quickly, as a medical expert working in this particular region, what would you advise parents do? How do they ensure that their children receive vaccination timely?
Okay. I think it's good to, first of all, for the mothers to enroll in the antenatal. So this kind of prepares them, equips them with the information that they need when they give birth, to follow through with the health seeking behavior of the mother and for the child, because the health of the mother is also reflected on the child. So if these mothers start early by preparing themselves through antenatal visits when they're pregnant, you find out that those mothers who have gone to antenatal visits are likely going to get their children vaccinated. However, it is still important, even if a mother has not had the opportunity to have antenatal, to also take the child to get vaccinated, not just measles, but to enroll for other vaccine-preventable diseases. Yes, so that's the message.
Earlier, during the course of the program, you did talk about actors, collaborating. I'd like to know the role of MSF so far in this particular outbreak, and also your collaboration with the state primary healthcare and also the Ministry of Health.
So our role here is that of both surveillance, because we receive a lot of cases from all over different areas and LGAs. So surveillance, the data we keep would help to identify the hotspots. Where are the hotspots, where actions are needed, and our doors are always open. You see all the other relevant actors in the health ecosystem come to our facility to get this data, and we always advocate for the children. That is our own position. So, but also in terms of clinical management, that is our primary obligation in case management. So apart from that, we help in advocacy and surveillance. We are like the eye of the government and other health actors to identify the hotspots of this outbreak.
Very well then, and that's the much we can take on the program. Thank you so much, Dr. Okoli Jumbo, a medical activity manager and a representative from Medicine Sans Frontiers, for providing valuable insights into the measles outbreak and the efforts being made to address it.
Thank you.
And now remember that staying informed and vaccinated is key in preventing the spread of measles. That concludes this week's episode of the program. Now, for comments, contributions, and suggestions, remember to follow us across all of our social media platforms and also join our YouTube live stream, more episodes of the program. And that's how much we can take. Thank you so much for joining us on the program. Bye for now.